An outpatient surgery center is a suite of operating rooms that has exactly the same facilities as the main OR in a large hospital. It allows us to perform all of the procedures that we're capable of performing in the main OR, but it's in an environment that's particularly suited for patients coming in and leaving on the same day. They came into being as a way to help people receive procedures and return back to their lives faster with less time in hospitals. The number one concern that patients have is that they're going to end up in a situation where they go home and their pain's uncontrolled. And that's never been a problem for me. I've never had to admit someone to the hospital for pain control after an outpatient surgical procedure. And so typically I find that their nausea is less, the amount of pain medication they consume is less, and they do much better than they would normally expect. But it's always difficult squaring that patient expectation with the reality, because in a hospital they can kind of ask for and receive whatever they need instantaneously. But in the surgery center environment, we now have enough experience for knowing what patients are going to need after the surgery, that they are sent home with the appropriate medications, and our anesthesiologists are very good at following up with them on the telephone. So oftentimes our patients after a procedure actually have more one-to-one contact with the doctors that took care of them, especially the anesthesiologist, the recovery room nurses, and myself. Perhaps it's via telephone than it is face-to-face in the operating room, but they get plenty of attention. The single most common concern that patients have before embarking upon an outpatient surgical procedure is whether or not their pain will be controlled afterwards. And we have systems in place to make sure that they have adequate pain control after the surgery to a level that's commensurate with the amount of pain control that we're able to provide them with in the hospital. Typically, we'll call their medications in advance and we'll make sure that they've been picked up before the patient even goes home. One of the nurses from the surgery center will call the patient the night of the surgical procedure, and oftentimes the anesthesiologist will also provide a follow-up call.
I think one of the advantages that I see at a surgery center is that we're able to deliver this care in a very low infection rate environment. There aren't the types of bacteria you see at a hospital or at a nursing home.
When it comes to costs, it's definitely less expensive and more efficient to have procedures done in a surgery center. In the surgery center environment, the patient is typically in the healthcare environment for a shorter period of time, which results in more efficient care, less charges assessed to the patient, and we're able to pass that down directly as a benefit to the patient themselves. So one of the patients that I remember best when it comes to doing cases in a surgery center as opposed to being in the main OR is I operated on a mother with 2 children who needed a lumbar disc operation, and she was just anxious as she could possibly be before the surgery. She had a million unanswerable questions about how long she was going to be out of work, what was going to happen about driving the kids to and from school, and like a typical go-getter soccer mom, she has a very overscheduled life. I did her surgical procedure on a Wednesday, and I came to work to see some patients in clinic on Friday, and I stopped like I usually do at the coffee shop on the way to work, and there she is in line getting a latte ahead of me. And the look of relief on her face and the hug that she gave me after she got her coffee and went on with a busy day was extremely rewarding.
So over time, my confidence in the surgery center has really grown. And consistently, when patients come back to see me in the office, they have glowing remarks about how great the care was that they received here. And that really means a lot to me as a surgeon.
So in my personal career as a spine surgeon, I trained at major academic universities where we tend to do large cases with prolonged hospitalizations and long recoveries. And then as you go into the community, and as technology has changed over time, we've really tried to decrease the length and the complexity of our surgeries and do more with less, so to speak. And that spawned the entire minimally invasive revolution in spine surgery. So one of the most fun things for me now is to do a small operation on somebody, see them recover extremely quickly, and return back to activities so fast that it surprises even them. So it's always really fun to have someone come back to clinic and say, I had no idea that I'd be able to take a trip to go and see one of my children or grandchildren graduate this soon after surgery. I've had patients who have returned to things like mixed martial arts training within 6 months after surgery.